You are watching the Doctalk show.
Palliative care medicine addresses a patient as a whole. It seeks to address the patient's physical, psychological, social, and spiritual needs with the aim to improve their quality of life, especially if they are suffering from a chronic illness. So I want to find out, where exactly can people receive palliative care services from? Ms. Rose Janka, as the ED of the Executive Director of the Palliative Care Association of Uganda, you have seen palliative medicine evolve. So where exactly can people get these services that we're talking about?
Thank you, Dr. Darius. Palliative care can be gotten in various places. We have different models that we use to provide palliative care services. But also we have different centers that are providing palliative care services. As I told you, in 1993, that is when Hospice Africa Uganda came into play to provide a service to these people. In 1997, Mobile Hospice in Barara was opened. At the same time, Little Hospice Hoima was also opened. But after that, a number of other hospices came into play. For instance, we have Hospice Jinja, which came into play in 2003. We have Mbale, Joy Hospice in Mbale. We have a number of hospices, standalone hospices, but also we have government hospitals, especially the regional referral hospitals, where we have trained a number of healthcare workers and they have formed a hospital palliative care unit. For instance, Mulago National Hospital has Mulago Palliative Care Unit, but also we have the different models that are used, whereby patients can come in as outpatients and they are seen. Then there is home-based care. Most of the standalone hospices actually provide home care services. We also have roadside clinics, whereby a patient waits for the healthcare workers as they go out to do an outreach, and then that patient is seen by the roadside. Okay. So there are a number of them.
So it is spread all throughout the country, in most hospitals and in most specialized clinics.
Yeah.
Yeah, you keep mentioning the term hospice. One would think, is that the same as palliative care?
Actually, hospice is a philosophy of care. This terminology originated from actually a clinician called Dame Cicely Saunders, who came up with this philosophy of care, who saw patients who were dying in agony, in pain, and wanted to help them. And with that approach came the whole terminology of hospice, which actually means care for the terminally ill patients.
Okay.
In the other parts of the world, hospice care actually means that care that is provided when disease-modifying treatments have been stopped.
So someone is close to their
someone
end.
is close to their end, and yet they still need to be cared for. And as we said that, you know, these patients who are close to death, they have a lot of needs, and those needs usually are non-physical.
Okay.
So
although I think palliative care is much bigger than just terminal illness.
Exactly. So palliative care is broader than that, in the sense that hospice is just a small portion of what palliative care is. In fact, palliative care has a lot to do with the care at the time when the life-limiting illness has been found out, and it's not necessarily at the time when these patients are dying. So that's the difference between these two.
And probably I just want to emphasize that when you hear hospice, don't think it is a building where you're going to take your patient. Hospice is a philosophy of care. That's what, in a nutshell, people should understand.
Okay. Yeah. It isn't a hospital.
It is not a particular hospital or a building. So it's actually called hospice care.
So thanks for that clarification. So you mentioned there are very many centers around the country where people can access palliative care. Palliative care.
Right.
So, who would be providing these services?
Palliative care is provided by doctors and nurses who have been trained in palliative care service provision. It is a specialty, and people really go for 9 months. For nurses, undertake 9 months training to make sure that they provide this service. When they qualify, they get a diploma in palliative care nursing, and then they go out and see these patients. And they are special nurses because they are allowed, they are the only nurses who are allowed to prescribe opioids for these patients.
Opioids, like the strong medicines, like the strong painkillers.
The strong painkillers like morphine, which you hear about. Nurses who have trained in palliative care are allowed to give these medications. And doctors are also trained in palliative care to provide this service. And Dr. Jack can actually give you more information about how the doctors also train and be able to provide this service.
Maybe not to focus much on that, but people would be interested in seeing how exactly palliative care addresses their needs. Because you talked about different needs.
Right.
So how will palliative care address them?
In a very simple way, we have to understand that palliative care is offered in a multidisciplinary approach, which means that there is a number of people who are not necessarily clinicians who offer this care. And so in terms of the provision, for example, patients who have spiritual distress or who have needs in their spirituality might benefit best from either a pastoral leader, okay, or someone who can come and give them comfort in that context. I also want to mention that there is a lot of need for patients who have social needs, patients who have limited social support, patients who don't have family, patients who are struggling with finances can benefit from the social aspect and the social workers and the volunteers.
Okay.
I also want to mention that in terms of this psychological care or psychological needs, there are patients who can benefit a lot from psychologists, clinical psychologists, but also from counselors. Okay, so in a nutshell, it is not only clinicians like doctors and nurses who can offer palliative care. I think it encompasses more people.
It's a team
to give
of
sort of,
people working together.
Absolutely. And as a matter of fact, sometimes we have to go and coordinate all these people so that the patient can benefit from all these specialty.
And I'd also like to add that the family is at the center of all this. We work with the family members to make sure that they're involved in all these areas. Because you may find that actually the person who is causing the most pain is the patient, is the family members. So we talk to these family members, make sure that they are on the same page with the patient. At times, family members may know a problem and they don't want the patient to know. And that causes a lot of distress and conflict within the family. You may find that actually this patient has cancer, but her major problem is the children she or he is going to leave behind. So we talk about that, and if possible, explore who are the people who might help these children when this patient is gone. And that will give a patient so much comfort. And you'll even verbalize and say, I'm now okay, I'm comfortable.
So that's amazing work by palliative care medicine. So we'll be back just after this break. Remember, you can send in your questions or comments. If there's anything about palliative medicine you've not understood, the lines are always open. Send in the questions on social media. You can also log onto our YouTube page. In case you've missed this video, you'll find it uploaded right there. So after the break, you will listen to an interview with a patient who has experienced and has benefited from palliative care medicine.
You are watching the Doctalk Show.